Hello, my name is Erica at Footprint to Hoofprint Equine Bodyworks and Services. Today I'm going to demonstrate an assessment for Ford before I give him any bodywork session. So that's going to entail an analysis of his gait. I'm also going to do soft tissue. I'm going to be looking for any kind of texture, tenderness, temperature, any kind of anything that's abnormal with his soft tissue muscles. Any of that can lead to range of motion dysfunction and of course muscle soreness. So with that, this is Ford. He's approximately 14 years old. He is a quarter horse cross. He is one of my personal horses. He has been diagnosed with EPM. So I am going to tap into, or attempt to tap into, his craniosacral rhythm today as well. This is going to be great to determine if that's something he would need. So with that being said, I'll go ahead and start the gait analysis. All right, so I'm going to go ahead and ask my lead walker to bring Ford all the way out in front of me and then side to side in a walk. So right now I'm just kind of checking for Ford to make sure he's not limping. I'm going to see if he tracks up, see how he turns here, if he's more out with his legs or in with his shoulder, which he's looking pretty good at the walk. He did kind of stiffen up a little bit, but so we got a lot of flies today. We're here in Central Florida and it is really hot out and the flies are all over him. So if you just want to have him more in a forward walk, so just have him walk a little bit faster. Okay. So Ford tends to land toe first, so we are working on corrective barefoot trimming for that. Okay, so he's tracking up, so that's good. All right, so now we'll see him in a trot here. He'll go into a trot. Ford is probably a little overweight. Okay, so it looks like he's actually collecting his neck not too high. He's tends in the past has been up higher. Okay, there his head's up a little high there. So there he goes. He's kind of turning his head a little bit. A little choppy in his gait, but not too bad today. There you go, very forward. It does look like he's tense though in his cranial, upper neck, shoulder areas. All right, so that's great. We're gonna go ahead and pause and then we're going to do the rest of the assessment to show you. Okay, so now we're going to start with the vitals. This is very important during assessment for the reason of contradictions. You don't, you want to make sure the horse is okay. For example, like doesn't have a temperature or maybe have a cold or something like that going on. So I'm going to go ahead and check his heart rate. So I'm over here on the left side, behind his elbow. Okay, that was about a minute, and then he's about 32 heartbeats, so that's within the range. While I'm here, I'm just going to make sure I hear some gurgling. He has no signs of, any colic, but I just want to kind of hear those gurgles. All right, so And then I'm gonna do his respiration. I'm gonna see if I can hear his breath here. If not, I'm just gonna put my hand on over his muzzle a little. All right, so he's about 13 respiration rates. Just gonna check for hydration. It's going back pretty fast. It's pretty good. So he's pretty hydrated. So Ford is super sensitive looking at his capillary refill. So I'm just gonna see if we can try that with him. I'm gonna ask him to lower his head. Yeah, good boy. It's okay. It's okay. Okay, so his gums are pink. So that's good. But I'm gonna go ahead and skip the capillary refill time just because he's very sensitive to anybody touching his mouth. Don't want to over stress him here. So that's good. We have respiration. We check for his heart rate. So everything is within the normal range right now for him. So I'll go ahead and pause, and then we're gonna start on the other sections of the assessment. Okay, I'm gonna go ahead and start with the range of motion. So I'm gonna start up at the front end of the horse, the cranial side. So we have his occiput here. So I'm gonna ask him to just bounce his head a little bit. And not much reaction there, which is really good for him. I'm gonna check his cervical process here, C2 through 7. Actually, let me check his wing of Atlas here. I'm just checking for symmetry and the narrowing outside of the Atlas, which is the same on each side, so that's good. Okay, so now I'm just gonna ask him to bring his head in here laterally. He's a little sensitive here. Okay, so he's just a little stiff there doing that, so I'm not gonna really push that too much. C7 is underneath his scapula shoulder, so I'm gonna go ahead and ask him to bring his leg out for me. So I'm going to check for his scapula to move, which I don't really see his scapula moving too much. So he's definitely stiff, C7. Alright, so now I'm going to move down to his limbs. Here you go, buddy. So I just want to make sure he's squared. Then he can come back on his diagonal when I ask him to lift his leg. There you go, buddy. Good boy. So his knee, his knee comes up to his cannon bone, which is really good. We have his shoulder, good range of motion there. So we have his fetlock. So I'm going to be taking a look at the range of motion in his both hooves here. Okay. We have his lateral cartilages. Okay. He's a little contracted. Checking his suspensory ligaments. No reaction, so that's good. His elbow. Good boy. So there's definitely tension, C7, stiffness in his left side of his cervical process. There's definitely tension going on there. It could be from his contracted heels. So I'll go ahead and note that. So now I'm just gonna check for his withers, down his thoracic, lumbar, sacrum. No reaction there. So he's got a saddle scar here. This has been here since I've got him. So he's had some saddle issues in the past. Square him up and back him up, have him on his diagonal. So I'm going to go ahead and check his stifle. I'm going to ask him to bring his leg out and see. He's bringing his leg back, but he's definitely a little stiff. So I'm going to check his hocks now by bringing his leg forward. Here, buddy. Okay, he's stretching into that nice, but he's definitely like stiff about that. He's definitely stiff. Oh boy. I'm just going to come back here and check his range of motion in his hoof, lateral cartilage. He's a little contracted, but he's well on his way. So we have deep digital tendons and superficial tendons. No reaction there. That's good. Okay. Back up. Stifle. All right, so a little stiff in his hocks. Just making sure he's okay here with me touching his tail. He's loose, but not too loose. That's good. Okay, I'm just gonna come over to the other side now. Checking his occipital bone. Okay, no reactions there. Okay. I'm gonna ask him if he'll bring his head in for me. Laterally. Range of motion, which he's very tight. He's kind of turning his head up. It's just stiff. He's stiff all the way down. Good boy. Just gonna bring him up in balance because I'm gonna ask him to bring his limb up. So I'm gonna bring him in balance so he can support himself. Okay, so his fetlock goes up and touches his cannon bone, so that lets me know that his knees are feeling pretty good today. Lateral cartilage, motion. He seems about the same on each side. So I know I have these fly boots on here, but let me just take this one off really quick so y'all can see. Sorry about that. I should have took these off beforehand. Just get him in balance again to let him be on his diagonal so he's more comfortable lifting up his legs. So we have fetlock. So his digital, deep digital and superficial tendons should be loose. So, not too loose, but they're not like super tight, right? There's no reaction there, fetlock. Okay, so that's really good. Okay, let me check his shoulder. That's good. Got off kind of balance there, but all right. So we'll bring that down nicely. All right. that was good. His shoulder was humeral joint. Everything felt really good. He does land toe first, so we're working on trimmings that focus more on internal, parallel to internal structures of his coffin bone, so that we're getting there with that. It's going to take a little time. So working my way back gradually, going along his thoracic spine, just checking him for his nonverbal. He's having no reactions to me. All right, so that was an indicator that that might have been uncomfortable for him. All right, so now I'm gonna check this side of his making me do all the work today. I'm just extending out for his stifle, see how the range of motion for his stifle is, which, I don't know, like he's going back and he's definitely a little stiff there. Thank you. So now I'm going to check his hock. Just going to let him extend out, which he went right down on the ground. It was kind of tough for him for that. So let's see how I like to do a circle over where his hip joint is, which is below his pelvis bone. Okay. See if he comes back or not. Okay, I got to feel his hip move by doing that. Okay, so I felt the range of motion and it was fine. Okay, I'm going to work my way back up cranially. I'm going to check his TMJ joint. Range of motion here, just kind of warming him up a little bit. Touching his TMJ joint. So he's a little sensitive, but I'm going to see if I can hear any clicking, and I do not hear clicking. I'm going to double check this side. Okay, there's no clicking. And I did get to feel his teeth earlier when I was trying to check for his capillary refill time. His teeth are all lined up. So sometimes if there's a dysfunction in the TMJ joint, sometimes their teeth are set off to the right or to the left. So see if I can take a look at that and get it on camera. He says, nope, nope, nope. Nope, nope. Okay, okay. All right. All right, so far range of motion, he is definitely tight up in his C7, C2 through C7, and his cervical process, transverse process. And he's tight in his hocks and stifles today. So now I'm going to go ahead and do palpation. So this is where I just check for tenderness, texture, tone, temperature. I don't know if I already said that or not, but this is where I check his soft tissues for knots, anything that's abnormal. I am going to watch his ears and his eyes, because that's going to let me know, hey, this is uncomfortable. So we got the brachiocephalic muscle, the splenius, trapezius muscles, triceps. You have your flexor and extensor muscles here. Pectorials, no reactions there. He has a little scratch right there. buddy, I know. Right. We have the medial glutes, longissimus muscle. Again, we have this old saddle fit situation going on. There's a few white hairs up here. It's pretty good in his coastal muscles, longissimus, obliques, medial superficial glutes, inner thighs. So I'm just feeling around for anything here abnormal. I'm just going to walk around here to the other side. Superficial glutes, inner thighs, flexor. No reactions going on as far as sore muscles. I'm not feeling any knots so far. Obliques. Okay, so his mane on the lower side tends to flip over. Not sure if I'm completely convinced that that indicates a compensation, but that could be an indication of compensation on his left front limb. Okay, so just checking for knots. He had a knot here I've been really trying to work out. Okay, Bubba. You're doing good. And I don't feel it right now. Okay, so we have his splenius, brachiocephalic muscle, pectorials. I would say that he's underdeveloped in his thoracic sling. We've been working on that, building up those muscles with ground exercises. Come here, Bubba. Okay, so not feeling too much in the palpation today for soft tissue. A little tight in his hamstrings and his inner thighs. He does tend to stand camped under. So we've been really working with bringing his feet back through corrective trimming and massage. So at this point, I'm going to attempt to tap into his craniosacral rhythm. Alright, so that's going to complete my assessment today for 4 to continue on with the craniosacral session. I think because of Ford's past diagnosis with EPM, I would like to utilize the craniosacral therapy to open up his central nervous system, to bring his central nervous system fluid to his head all the way back to his body. I would like to utilize this therapy to activate proprioception with him for more balance, and then of course just to reset his nervous system. All right, so that's gonna conclude my assessment today. Thank you guys and have a good day.